today. So my name is Dr. Leslie Allen. For those of you that do not know me, I'm the owner of the Center for Holistic Healing, and I've been a doctor of physical therapy for 14 years now and a holistic practitioner for 4 years. So part of my desire of opening the Center for Holistic Healing was really to change the face of healthcare, because as most of you know, we are getting sicker and sicker as a nation, and our current medical model is only treating the symptoms and not really addressing chronic disease very well at all. So this is something that I really recognized when I have many years experience in the home health arena, and there I was dealing with very, very chronically ill people, and I found that it was becoming increasingly more difficult to help those people get onto a path or a journey to optimal health and wellness. And it was really my health that guided me to functional medicine when I was diagnosed with 2 different autoimmune conditions. One was a skin condition and the other was Hashimoto's, which many people are suffering from as well. And so I immediately recognized as a patient that the traditional system had no idea of how to really truly help and treat autoimmunity or chronic disease for that matter, and they were only willing to address my symptoms, but never to really address the underlying condition of why my immune system was actually attacking my body. And so this is where functional medicine really guided me, and I really began to dive deep into gut health, and hence the reason that I am so passionate about the topic of the leaky gut solution. So with that being said, let's go ahead and dive in. Oh, there we go. Sorry, my computer had froze for a second. So the importance of gut health. The gut, also known as the gastrointestinal system, is truly the gate to overall health. The gut microbiome is an ecosystem that consists of good bacteria, bad bacteria, viruses, fungi, protozoa throughout the digestive tract, far beyond just digestive health. The following organ systems are also closely related to gut health. So Jackie, I see you've raised your hand. Let me see if I can. If you guys have any questions throughout the webinar, go ahead and type them into the Q&A, and I will try to remember to stop and periodically answer any questions that you have along the way. So definitely just type them into that Q&A section, and I'll answer as we go. So the following organ systems are closely related to gut health. These are the immune system, our endocrine system, the nervous system, our circulatory system, the integumentary system, respiratory, our reproductive system. So a few key points to remember as we're going through this webinar today is that there are 10 times the amount of bacteria in our body than actual cells that make up our body. So that is quite a large amount of bacteria that we do have within our system. The GI system contains 90% of our body's happy hormone, which is serotonin. And so what that means is serotonin is the hormone that allows us to actually feel happiness. And 90% of that is created in the gut. Most importantly, though, is approximately 70% of our immune system is housed in our gut as well. So as you can tell, the gut doesn't stop at digestion. The health of our gut affects nearly every system in our body. So what is leaky gut? Leaky gut is a term that refers to intestinal hyperpermeability and has become increasingly more common health problems seen today. So leaky gut causes major health problems, including autoimmunity. And how this occurs is that intestinal hyperpermeability is exactly what it sounds like. The digestive tract is no longer able to ensure that the good stays in and the bad stays out. So we have these tight junctions that are in between our mucosal cells. And if you think of our gut lining as a fence, and in between that fence, we have connectors. It's those connectors that end up getting weak with time. So this eventually is going to leave sizable gaps for undigested food particles, digestive fluids, and toxins to then enter the bloodstream. The body reacts to these foreign particles in the blood by producing immune antibodies or pro-inflammatory cells to fight them off, which eventually is going to breed chronic inflammation, the food allergies, and various health complications. Of course, there are no signs of improvement until the gut permeability is actually addressed. Fortunately, we now have a better understanding of the causes, obstacles, and treatment methods for leaky gut, so there is a way to actually stop this cycle. So how the gut actually becomes leaky, there are several different factors that really prove to have a negative impact on the gut's integrity. The most prominent include the standard American diet. So unfortunately, we know eating fast food, it only takes 2 weeks to completely wipe the bacteria, the good bacteria that are lining the gut. And so then you start to get this imbalance of where the bad bacteria then takes over. So that ecosystem that I was talking about, everything keeps itself in check. So the good bacteria keep the bad bacteria in check, the good bacteria keep the yeast in check, and so on and so forth. They all have a role there, but it's when we get these imbalances that we then begin to start having problems. Exposure to chemicals can also impact the gut's integrity, chronic infections, gluten and other grains, food allergies, excessive medications, and poorly managed stress. And we're going to go through each of these. So the SAD diet, which is also known as the standard American diet, is one of the leading causes of chronic health issues today. According to a 2009 study conducted by the USDA, 63% of the calories Americans are consuming came from processed foods containing preservatives, refined grains, and added sugars and oils. It's as though we've taken the food pyramid and we reconfigured it. So we've got grains at the base, dairy in the middle, sugar at the top. When honestly, none of these foods or products deserve to be in our diet at all. FROOD. So you can call it FROOD, frankenfood, food-like substances, fake food, but you most definitely can't call most of our food supply real food. So most of our diets are packaged meals with paragraph-long ingredient lists and labels that we can't understand. So we're not really eating real food. Real food are apples, bananas, broccoli, chicken, things to that nature, not things that have an ingredient list of science words that no one can really understand. A couple of alarming facts. The United States Food and Administration has approved approximately 3,000 different food additives, preservatives, and colorings without adequate research on safety. So the average person ingests over 150 pounds of additives each year. The magnitude of these chemicals that are allowed into our lives is incomprehensible. we are becoming more and more aware of the consequences from this fake food lifestyle, and it's simply unacceptable. This is only one factor in the leaky gut epidemic, but it's definitely a big one that we need to be aware of. So up next, we're going to be discussing the other factors responsible for the onset and progression of leaky gut. Inflammation is a vital immune response. It's normal. Actually, as a physical therapist, many times I need to facilitate inflammation to actually promote healing, because it's going to activate a normal immune response to then come in and heal the tissue that we're trying to target. Chronic inflammation, however, is not beneficial to our bodies in any way. In fact, it can actually weaken the body's ability to recognize foreign invaders and puts the body in a state of stress for an extended period of time. This can cause lasting damage, increased food allergies, and eventually autoimmunity. This type of inflammation can be caused by a number of things, but largely seen as a result of leaky gut syndrome and poor dietary habits. So if chronic inflammation goes untreated, leaky gut gets worse, and the body ultimately loses its ability to repair the damage. Gluten, and this is such a sad one for so many people, because we tend to gravitate toward those comfort foods. So most of my patients and clients don't necessarily love to hear this when I tell them, but gluten is a general term for a mix of proteins in many grains such as wheat, barley, and rye. It's found in much of our food supply. It's disguised in many of our packaged foods. And so most of us don't even really realize, even if you're avoiding gluten as in breads and pastas and things like that, you really have to be read food labels closely if you're still consuming packaged goods. It's no surprise that our consumption of gluten has increased immensely and our health is suffering from it. So gluten allergies, sensitivities, intolerances are becoming increasingly more common. Gluten-free has become a buzzword within the health community, and people are finally beginning to explore how dangerous gluten can be for our health. So how dangerous is it? Gluten makes our gut leaky. Simple as that. There is a protein, it's called zonulin, and it's found in the gut, which is responsible for loosening the tight junctions. This is important. It's, when we are digesting food, we need absorption of the nutrients from that food. And so zonulin is actually what allows those hooks that connect the mucosal cells together to loosen just enough so those nutrients needed can seep through. But unfortunately, gluten causes the zonulin to increase the size of the opening. So much larger molecules and proteins can actually seep into the bloodstream. Gliadin is a building block of gluten and bacteria from the small intestines. So I know most of you have probably heard of SIBO, small intestinal bacterial overgrowth. These two things, so the building block of gluten and the bacteria from the small intestines, are the two largest triggers for the increase in the amount of zonulin that you have within your GI system. So as those zonulin levels increase, this is going to continue to impact the mucosal tight junctions, causing more and more inflammation. As those get looser, that inflammation, the things that we can eat, then seeps into our bloodstream. And that is going to keep our immune system at a heightened state. So our immune system is going to constantly be trying to fight off these particles that are seeping into the blood. It sees them as foreign molecules. So we keep this heightened state of inflammation, and the immune system stays at a heightened state. And so it's just constantly roaming the body looking for these foreign particles. And this is really what can cause the onset of autoimmunity. So how gluten harms? Aside from contributing, if not entirely causing leaky gut, gluten increases inflammation, overall digestive distress, and alters the balance of our microbiome. Our microbiome must be equipped with efficient, healthy bacteria in order to be successful carrying out its necessary function. So without this proper balance of bacteria, the following functions are going to be disrupted. As you can imagine, digestion, that good bacteria is going to help to break down the foods. We're no longer going to have a normal immune response. We're going to have malabsorption of our nutrients, hormone dysregulation, vitamin production will be altered, detoxification, mood management, and many more. I'm just going to make sure we don't have any questions there. I think we're doing good. All right, so with gluten, it's going to produce both primary and secondary effects. The damage gluten causes that we have talked about thus far, those have primarily been, those are primary effects. So that intestinal hyperpermeability, leaky gut, it can actually create what's called permeability of the blood-brain barrier. So similar to that mucosal lining, we also have a barrier that really is important to keep inflammation, toxins, irritants out of our brain. So it's really important that nothing alters that, our blood-brain barrier. The onset of autoimmune diseases, that's a primary effect of gluten. The development of psychological disorders, so ADHD, autism, bipolar, those are thought to be contributed from leaky gut. Dysbiosis and abnormal bacterial growth. Acute allergic reactions, which are an IgE response. We're going to go through IgA, IgE, those type of immune responses in just a second. So while all these issues are very serious within themselves, they too cause further complication. So the secondary effects of gluten exposure, those are going to be your severe nutrient deficiencies. And these are going to be iron, vitamin B12. You're also going to get systemic inflammation because when you eat inflammatory foods, that inflammation is then seeping into the bloodstream. The blood travels all over the body, so it's carrying this higher level of inflammation throughout the body. That chronic level of inflammation, it's going to fuel other little disease processes. So if you have any amount of arthritic change or anything like that within a joint, that low level of inflammation is going to fuel it until it becomes a full-blown exacerbation. So gluten is a major component in the leaky gut cycle. It is present in the onset, the maintenance, and the progression of this damaging condition, and it really shouldn't be taken lightly. So with gluten, it's a pretty direct process to disease. So the first step with gluten contributions, those can go unnoticed. This was the case for me for many years. I had no idea that I had a gluten sensitivity. You have very little or no symptoms at all, but that still doesn't mean that it's not creating inflammation or a low level of inflammation in the gut. The next step in the progression is actually a subclinical problem. So this is where leaky gut truly begins to develop. Often the first things that will be noticed is increased food or environmental allergies. Digestive distress may begin. to become more frequent, like bloating or stomach cramps after you eat something, dairy, anything that tends to be inflammatory, that can become more pronounced in this subclinical problem. For me, I began to have irritation in the small joints of my hands, especially after I had worked a full day doing manual therapy. So really using my hands a lot, but I had no clue that it was coming from gluten. And it wasn't until I actually did an elimination diet, and that's what I tell most people. You may have no idea that gluten is creating symptoms until you actually take it away. And it really, and we're going to get into all of this, but it really, you have to eliminate it for at least 23 days, because that's going to kill your IgG, your immune response, those immunoglobulins that you've created to the inflammatory gluten. The last step is actually recognizing the problem. So, however, it's not usually recognized that gluten is the problem, but the acknowledgement of the problem that gluten has caused. For example, most people are diagnosed with a chronic disease before they even realize that they have a low level of chronic inflammation. So it's inflammatory changes, and then our medical doctors are going to treat the symptoms of the disease process and not ever begin to explore what's actually the origin of the problem. So it's a shame that this happens so often, as if gluten was recognized as the main problem during the early stages, then a lot of our health issues could be avoided altogether. So I know I keep harping on this, but it is really important. This I do with all of my physical therapy patients, but also my functional medicine clients. We have to take gluten out of the equation in order to see the symptoms that it's actually going to produce. So the next category are pesticides. And so we are ingesting so many pesticides. Much of the additives and preservatives that are flooding our food supply, pesticides are also a big part of what's on our plate. There are 3 million tons of pesticides used worldwide each year, and more than 16,000 chemicals involved in the production of these pesticides. Studies to ensure their safety on humans have been very limited. This is the same for all of our personal care products and our cosmetics. And that's actually going to be my talk next month that I do. I'm going to go through how our gut is, or how our skin issues are a direct reflection of our gut health, and how the toxins that we're absorbing from the products that we use on our skin are directly impacting our health as well. So tune in for that next month. But while we're not entirely sure of their safety on human health, we do realize a strong link between pesticide exposure and nervous system disorders, immune system suppression, reproductive damage, hormonal imbalances, thyroid issues, type 2 diabetes, obesity, asthma, migraines, attention deficit disorders, and developmental delay in children. The magnitude that these pesticides, along with steroids, hormones, antibiotics, excitotoxins, show up in our food supply is truly frightening. And to think it isn't a main component of our leaky gut trend is simply impossible. As most of you know, medication is severely overprescribed in our current medical model. Medical programs train doctors to medicate symptoms, even when they're unsure of the cause. This, in the short term, has seemed to work because the patients experience temporary relief. Unfortunately, when you're not feeling well, we want to feel better right now, right? We're all super busy, and to be sick really is, it hinders our life, and so we want that quick fix. But what isn't taken into account is how these excessive prescriptions can affect our body. For example, statins. How many people are on medications to lower their cholesterol? Quite a few. So we also know that statins are going to lower your vitamin D, your CoQ10 levels. These are essential vitamins that are needed to make all of our other pathways with our body work efficiently. So while the statins do help to actually lower cholesterol, it's simultaneously causing nutritional deficiencies, muscle fatigue, increased blood pressure, weakened immunity, and now the studies are actually coming out to say that there's a significant link between statin use and dementia. So painkillers, this is one that I struggle with quite a bit as a physical therapist and educating my clients. But things like ibuprofen, naproxen, aspirin, they're all going to contribute to vitamin C and iron deficiencies. And they're also going to leave one vulnerable to disease because they're going to erode the mucosal lining of the stomach. So they're going to end up contributing to ulcers and different things like that. They're also going to impact our ability to absorb nutrients. And as the stomach is responsible for starting to digest some of that food, it's going to be impacted by these painkillers, thus causing increased inflammation. And in the end, that increased inflammation is actually going to contribute to increased pain. So they start to get into this vicious cycle once they do start to take those painkillers. So really trying to advocate other pain mitigation strategies like soaking in Epsom salt, water baths, using a heating pad, different things like that. Acid reduction medications hinder digestion. So these are your proton pump inhibitors. The people that have acid reflux, they're really going to impact the digestion of protein, calcium, vitamin B12, and often are going to be directly related to chronic pain problems. The long-term use of antidepressants, too, is going to significantly impact the gut's motility and cause other digestive issues. Lastly, it's important to note that almost all medications are unable to differentiate between the good bacteria in our gut and the illness it is trying to attack. The result is that it alters our microbiome and it creates an increased risk of infection. So as you can tell, drugs are going to offer a lot of unintended consequences that can affect our health pretty badly. There are a few situations where drugs should be your solution: life-threatening infections or surgical situations. Without immediate emergency needs of a medication, it's really best to treat the issue rather than using this temporary patch to the problem. So the gut-brain connection. This is another one of my favorite topics. I'm actually doing a corporate lecture over this tomorrow for a local company here in town. But have you ever gone with your gut or felt the butterflies in your stomach when you were nervous? And these are actually signals from what scientists now call your second brain. This second brain is known as the enteric nervous system, which is actually found in the gut. It consists of two thin layers of more than 1 million nerve cells that line the GI tract from the esophagus all the way to the rectum. The ENS, so the enteric nervous system, ENS, I'll refer to it both ways, its main role is controlling digestion, from swallowing to the release of digestive enzymes that break down food, to the control of blood flow, to help with nutrient absorption, to elimination. So from the time that the food hits our mouth, this ENS system starts working. It's also referred to as our little brain. So our gut can have a direct impact on our brain's emotional state, and our brain can have a direct impact on our gut health. Doctors used to think that anxiety and depression caused symptoms of IBS, whereas now research is showing that the ENS may be the cause for the mood changes in the central nervous system when there is a GI irritation, which is really an interesting new finding in our research. So now that we understand the gut-brain connection, let's dive into how stress is going to have a direct impact on our gut health. So I want to first begin by saying stress is normal. We all have it. Our body has a system in place to actually help to manage stress, but it's our perception of stress that can have the biggest impact on our health. And when we remain in a constant state of stress is what causes the biggest problems. Stress is initially perceived by a region in the brain, it's called the amygdala. It then activates a portion of what's called our autonomic nervous system, our sympathetic nervous system. So the autonomic nervous system is made of the sympathetic and the parasympathetic. And these two systems work in a reciprocal manner. When one is high, the other is low, and vice versa. So the sympathetic nervous system is responsible for the fight and flight. That is when you have that surge of adrenaline when there's an intruder in your house, or you're about to wreck your car, and you're going to feel that. So it's an immediate response. The job of the sympathetic nervous system is to mobilize energy. It's to dump glucose into the bloodstream so you can either take off to get away, or you can get prepared to fight. So we're going to have our heart is going to race, our blood pressure is going to increase, our breathing is going to increase, cortisol, which is our stress hormone, is going to get dumped into the blood, glucose is going to be released into the bloodstream so that the muscles can utilize it to produce energy. You're going to have a decrease in blood flow to the gut, and so that way you can have an increase of blood flow to the diaphragm, the muscles in the legs, the muscles in the arms. We only have so much blood within our body, so the blood has to shift. So clearly, it's not time for digestion or absorption, it's time to run. Once the stress is gone, the sympathetic nervous system decreases, and we can return back to this state of homeostasis or normalcy. What is interesting with humans is that we can just think about stress and initiate that reaction. When we have chronic levels of stress constantly coming at us, then blood is constantly being pumped away from the gut. This will impact our digestion, absorption, as well as healing from occurring if there is an irritation in the gut lining. So one of my favorite resources on this topic is Why Zebras Don't Get Ulcers. And there's a Stanford University biologist, his name is Dr. Robert Sapolsky, that wrote this book. There is a great YouTube video out there. It is about an hour and a half long, but it's well worth it. If you deal with chronic stress, you really need to watch this video or read the book, because he breaks down how chronic stress impacts every single system within our body. But it's just really interesting because zebras have the same sympathetic nervous system that we have. But the difference is they can't visualize that a lion is going to chase them and initiate this response. So they get that return blood flow back to their gut that is going to heal any type of irritation, because the mucosal cells, they turn over so quickly, but it's when blood flow is constantly being pulled away that then impacts our health. So I'll be honest, I can get a client's diet 100% perfect. I can get them on the most perfect exercise regimen that they're compliant with and that they're following through. But if they're not addressing their daily stress, we're never going to heal their gut. So now let's talk about the 5 critical elements of our gut, our 5 defenses. And these are the things that truly help to keep our gut healthy. So in order from the most outer layer of defense, we have a mucosal IgA response. So otherwise known as an immunoglobulin A, this antibody found in the mucous membranes is considered our gut's first line of defense against toxins. So let's say that we're not eating organic strawberries and those pesticides come directly into our gut. The mucosal IgA will then respond to attack that toxin and prepare it for elimination. Tight junctions, we've already talked about these. These are the small proteins that are responsible for holding the gut cells together. This is what most directly is affected with leaky gut syndrome. We have the gastro-associated lymphoid tissue, which is known as GALT, and this is the gut's concentrated immune system. And as I mentioned earlier, 70% of our immune system altogether comes from this system known as GALT. This is the gut's last and most powerful layer of defense. The gut's accessory defenses include friendly bacteria. As we mentioned before, we have more bacteria in our body than we do cells. So this bacteria can communicate with the GALT, warning it of potential danger. Stomach acid. It is absolutely essential for digestion, absorption of nutrients, and defense against infections. I want to give you an example of this. We're actually going to see some examples and some case studies here in just a few minutes, but when stomach acid levels get altered, then bad bacteria and yeast can set up in the gut and they can flourish. And then they continue to alter the gut's pH level to an environment where they thrive and good bacteria don't thrive. It's their way to basically, as a mass takeover. So the beginning of functional treatment, the first steps of healing is ruling out the fundamental causes of your leaky gut. It's important to recognize that it's very rarely only one cause, but usually a combination of several causing the damage. So first, we must rule out or begin to recognize the following: vitamin deficiencies by functional nutritional testing, infectious pathogens by blood or GI tract test. I prefer a stool analysis that we'll take a look at in just a second. Heavy metal toxicity by urine or hair testing, gluten sensitivity through HLA-DQ genetic testing, environmental allergies via skin or blood test. So if any of these come back positive, you have your first step of instructions. You're going to address the deficiencies, implement dietary changes, limit exposure to allergens, and consider detoxification methods. So once you have a better understanding of the body's unique needs, then you can begin the formal functional medicine protocol, which is the 4R program. The 4R program is administered to help you heal from digestive distress, reverse gut complications, and rebalance your gastrointestinal microbiome. It is an incredible tool to acknowledge and treat health issues, dysfunctions, imbalances, and personal health needs. It is done in the following order. We're going to eliminate food problems. you have to do an elimination diet. And again, as I mentioned, it's a 23-day elimination diet. So that way you can eliminate some of the most common inflammatory foods from your eating program for 23 days. That's going to kill the IgG immunoglobulin response. That's the immune response. It kills that, and then you start to reintroduce these foods one food at a time. Just like for any of you that are moms, when you start to first feed your child real food, you start with one food at a time to see if that baby is able to respond to those particular foods or if they have any type of allergic reaction to them. You're also going to remove toxins, so really trying to eat a clean, organic diet. Making sure that your meats that you're eating are organic. Meat, dairy, and the dirty dozen are a must when choosing organic food. So that way you're not getting growth hormones, steroids, that those meats are being treated with, antibiotics that are going to continue to strip your gut microbiome. Any low-grade infections that you may have, or any oxidative stress. You want to, so the second R is repair. So begin reintroducing a clean diet with essential nutrients your body needs. Then you're going to restore. You want to repopulate the gut with healthy bacteria, typically done through a good probiotic, to restore the proper balance of the gut flora. And you want to replace digestive enzymes, antioxidants, immune-boosting vitamins to promote sustainable and healthy digestion. So we as functional medicine providers are trained in this protocol and typically pretty enthusiastic about making sure your individualized needs are addressed during this process. So removing the bad. At this point, you may have already removed things that you knew were detrimental to your health. And especially if you're in that second phase where you're starting to notice a reaction to foods that you are eating, you may have already taken it out. A lot of people have already removed dairy and gluten. Sugar is the other one that's kind of hard to remove because it's in just about everything, especially if you are eating any type of packaged foods. Those are the top three. If anybody removes anything from their diet, those must be the top three things that are removed. So also pesticides you want to consider. And as I mentioned, the dirty dozen, that is a really good list of the 12 fruits and vegetables. If you cannot find them organically, then really you should try to avoid them. So that is produced by the EWG. You can find it at ewg.com, or you just by searching the Dirty Dozen list. Unnecessary medications. If you're used to taking a proton pump inhibitor and you don't truly have an actual ulcer, then I would most likely guess that you had low stomach acid, not high, and that proton pump inhibitor is actually contributing to more leaky gut situation. And then toxins, and not just the toxins that you're eating, but thinking about your household products, your cosmetics, your shampoos, your conditioners, and different things like that. So repair, restore, and replace. Once you have an understanding of what should be removed from your daily life and you've begun to implement those changes, it's time to begin repairing the damage that was previously done. This is done by calming the chronic inflammation, reintroducing nutritious foods, digestive enzymes, probiotic, essential fiber, vitamins, minerals, and acids. So for some people, these steps may mean implementing intermittent fasting, supplementation is sometimes necessary, or personal diet plans that cater to your specific needs. Again, make sure that you're consulting with your functional medicine provider to be sure you are beginning the most appropriate repair route for your needs. And again, with the case studies, I'll be emphasizing the importance of why it is so important to know exactly what your problem is and not guess at it. There are so many bloggers out there. There are so many functional medicine providers out there that are essentially blogging. They're given blanket protocols. So everybody with autoimmunity, you need XYZ supplementation, or you need to do XYZ. Well, that's not an individualized approach. That is an assumption. So that's why it's so important to actually work with someone personally so you can get that more specific care. So, supplementation spotlight. Nutrients must be replaced for effective healing. And while everyone's needs are highly individualized, here are some common supplements that have been proven to be helpful during the gut healing process. Probiotics. So I'm actually going to flip to the next. So probiotics. My favorite one is ProbioMax Plus. I use a dispensary called Zymogen. They are professional grade supplements that are some of the most researched, and they have the safest or the strictest safety screening on the market. So I really have had great results with their supplements. This probiotic, this particular probiotic, ProbioMax Plus, it is 4 different strains of bacteria, of good bacteria that have been highly researched to make sure that those bacteria are actually going to withstand any pH changes of the gut, that they can actually stick to the gut lining, that you're not just going to be ingesting these and they're really not even, they can't make it past the stomach pH levels to actually get to the large intestines of the gut. Prebiotics. So OptiFiber Lean is a great prebiotic that is going to help to give your bacteria, your good bacteria that you are adding in, something to eat. Digestive enzymes are important. Fiber, as I mentioned, from the OptiFiber Lean, that's going to be your prebiotic and your fiber. Also, OptiCleanse GHI. This is a high-quality, lactose-free, vegan protein powder that helps support GI health, improve detox pathways, and decrease cytokine production, which is just an inflammatory response at the gut lining. I recommend combining this protein powder with an elimination diet for optimal healing. L-glutamine. This is an essential amino acid that helps to restore those tight junctions to help minimize and repair leaky gut. IG-26 is a GRAS supplement. It's going to provide an IgY immunoglobulin and immunoregulating molecules. These immune cofactors help support immune function in the intestines. So if you are having an inflammatory response at the gut level, then this supplementation is going to help to bring in the immune system to fight off that inflammation. And as a thank you for watching this webinar, you all will have access to these supplements through Zymogen.com, and you'll receive a 10% discount on your first order using my referral code, which is LB Allen. It's found at the bottom of this slide, and these are, as I mentioned, these are professional grade supplements that can only be bought if you have a healthcare provider that is recommending these to you. But I want each of you to understand the main takeaway from this is that you should not rely solely on supplements. They can be used to help your healing process, but the goal is to be able to sustain wellness with whole foods and healthy lifestyles long term without the need of piles of pills. So these are only suggestions. We are unable to prescribe these supplements to you without comprehensive testing. as everyone's nutritional needs vary. Now I would like to share with you a few case studies that to emphasize the importance of working directly with a functional medicine provider and why it's never a one-size-fits-all approach. So I'm going to share my screen here. Let me make sure I come to the right one. All right. So this is a client that came to me with IBD, which is irritable bowel disease. Sorry, let me get this. So it's a little bit back with is that this particular client has what is called Klebsiella. We all have a little bit of Klebsiella within our gut, within that gut microbiome, but he actually has an overgrowth of it. He also, these commensal bacteria, these are neither good nor bad, but to have so much there is just crowding out space for his good bacteria to actually exist. Lactobacillus is one of the most, it's one of the most common good bacteria to have in our gut, and for him, he has none that are showing up. This lactobacillus is actually responsible for keeping the Klebsiella in check, and that is why he's had this overgrowth of the Klebsiella. So what we do in this particular situation is we have to come in and remove this Klebsiella and add in the lactobacillus in order to repopulate his gut microbiome. So he has no yeast, which is good. So I just want to show you here. It's going to show us for digestion and absorption. This is the function of the pancreas. And given his age, this should be well over 500. So to aid in the digestion of the food that he is eating. And as you can see, he's having a huge inflammatory response at the mucosal lining. And then this, as we mentioned, that's that mucosal IgA, that first line of defense, and his is elevated. It's really working hard to fight against that Klebsiella that has taken over his gut. The short-chain fatty acids are actually what help to restore the leaky gut situation. And in his case, he's got very, very few. And that's probably because that lactobacillus and the bifidobacteria are so low that they're not breaking down the food to create these short-chain fatty acids to then help to restore that gut lining. And then those pH changes that I was talking about. See how low his is here? And then he's got occult blood within. So now let me pull up the next case study that I wanted to show you. All right. And so here, as you can see, this is a client with autoimmunity, fairly healthy, and had been on a lot of probiotics for a really long time, very good quality probiotics, and literally they're not making it to the colon. So they're not actually sticking to her colon. She had no yeast. Elastase was a little on the low side as well. Very little inflammation going on here. No major immune response. Short-chain fatty acids were fair, but they're all a little on the low side. So see this range here? I would love for that butyrate to be a little bit higher. So that did require a little supplementation. And so that was it for this particular patient. But I want to show you one other thing. So my question is, the fact that she had been on probiotics for so long, I wanted to know, where are those probiotics going? Another test that I do is called an organic acids test. Let's see. Sorry about this. There it is. All right. So with the organic acids test, let me see if I can get to. I'm going to start at the end and then we'll work our way up. But it's going to confirm gut dysbiosis. So I always like to run this test as well because it tells us our current state of what we have going on. So what I noticed is number 42, this is indican. And these are actually metabolites that spill over into the urine when you have blocked pathways. And when indican spills over, this is actually a byproduct of what is called SIBO, small intestinal bacterial overgrowth. So all the time that she was spent adding that good bacteria, she was actually probably supplying her small intestinal bacterial overgrowth. So all that good bacteria was going to the small intestines and not actually to the colon. So just to give you an idea of this test, it will show us our detoxification pathways, which here, hers were doing okay. Oxidative stress. So this is getting into the high zone, so high levels of oxidative stress within her body. These are neurotransmitters, so that dopamine, norepinephrine, epinephrine, so that sympathetic nervous system response. This is serotonin, so we can see it starting to creep up there, and that's probably due to that gut disruption from where she doesn't have enough good bacteria to then produce those serotonin levels. These are markers. The next three markers are for inflammation in the brain, and those looked fine as well. No issues with methylation. Her B vitamins were a little on the low side, but again, that's due to the gut dysbiosis, and the bad bacteria are eating up the B vitamins. So this tells us once food comes into our system, let's see if we can get that a little bit lower. There we go. Once food comes into our system, so you can see here, fatty acids, carbohydrates, when we eat, that food has to be broken down so that it then can enter what are called our mitochondria, our powerhouse. That's what produces energy from the food that we eat. And so this particular person is having issues digesting carbohydrates. And then once they're getting into the Krebs cycle where they produce the ATP within the mitochondria, she's having more difficulty actually getting that mitochondria to produce because she's got nutrient deficiencies from the leaky gut. So we have to correct all of that. And it takes really understanding in order to correct the problem. All right, so once you have corrected the problem, a lot of times maintenance is the most difficult part of healing. So even if you build a strong foundation during the healing process, without a proper diet, lifestyle changes, stress management long-term, you can fall right back into the same gut destroying patterns. Remember that health is a journey and it's not a destination. Although there's plenty of research on the dangers of leaky gut, it's still considered a medical mystery. Many cases go undiagnosed and in turn are not properly treated. So this is what makes it crucial to really work with a doctor that is familiar with the condition and will perform the appropriate test in order to help you heal effectively and efficiently. Always start with the fundamentals. So honor your body's unique needs. Skip the guesswork. At the Center for Holistic Healing, we offer a 16-week personalized program to help guide you through to optimal health. Your program is developed on labs, looking at your genetics, comprehensive stool analysis, macronutrients, micronutrients, mitochondrial health, liver detox phase 1, phase 2, inflammation, oxidative stress, neurotransmitters, hormone testing, and much more. So there's literally no more guesswork that goes into your health issues. You'll be guided through a 23-day elimination diet with food reintroduction. Then an eating plan based on your genetics will help with, if you have a goal of weight loss, an exercise prescription that will be dedicated toward your genetics, your unique makeup, and what your goals are. Stress management education, supplementation recommendations, and other lifestyle modifications. So the first step, if any of this interests you and you actually want to move forward, would be to go to the Center for Holistic Healing's website, which is www.chhpyt.com. There will be a button there that says Health Assessment Form. You're going to want to click on that. And then once I receive that form, I will review it, and then I can reach out to you, and we can schedule a free 15-minute phone consultation. And that way we can just go through what your options are and what your goals are in order to help you heal appropriately. So thank you so much for taking the time to experience this class. I absolutely love sharing this topic with people who are eager to transform their health. And really, this group was fantastic. So if you have any further questions, please post them in the Q&A, and I'll be more than happy to address them with you. All right. Thank you all so much. I'm going to... Oh, thank you, honey. My husband said, this is awesome. Thank you so much. Such a sweetie. All right. Any other questions? Well, I am going to end the recording. And if you do, you guys can always reach out to me also through